What death from vomit aspiration means. When someone inhales vomit, stomach contents, into their airway or lungs, this can cause immediate airway obstruction. Vomit blocks the windpipe, right pointing arrow, choking. Chemical, acid, injury to the lungs, Mendelssohn's syndrome, or aspiration pneumonitis, which can cause severe inflammation, pulmonary edema, hypoxia, and sometimes death. The severity depends on how much and how acidic the material is and whether particulate matter is present. Secondary infection, aspiration pneumonia, days later if bacteria reach the lungs. Common risk factors: decreased consciousness, drugs, alcohol, overdose, seizures, sedation, general anesthesia. Impaired swallowing or neurological disease. Large gastric volume or delayed gastric emptying, pregnancy, some meds. Vomiting while supine, lying on back. Signs that someone has aspirated vomit: sudden choking, violent coughing, difficulty breathing, noisy breathing, cyanosis, blue lips, face. Low oxygen levels, rapid breathing, fever or worsening cough developing over hours, days, if infection. What to do immediately, if this is happening now? If the person is choking and conscious, encourage forceful coughing. If they can't breathe or speak, perform abdominal thrusts, Heimlich, for adults, children as per local first aid guidelines, and call emergency services. If the person is unconscious but breathing, turn them into the recovery position, on their side, head tilted slightly down, so vomit can drain and won't enter the airway. Monitor breathing continuously and call emergency services. Use suction if trained and available. Do not leave them on their back. If the person is unresponsive and not breathing normally, call emergency services and start CPR immediately. If they vomit during CPR, quickly roll them on their side between cycles so airway can clear. Practical cautions: do not perform blind finger sweeps unless you can see and remove an object. Don't induce more vomiting. Avoid trying to feed, drink someone who's drowsy. Medical care and prognosis. Survivors may need oxygen, bronchoscopy to clear airways, antibiotics if infection develops, and ICU support for severe lung injury. Fatal outcomes are more likely when a large acidic volume is aspirated or when airway is blocked and not cleared quickly. How this is prevented. Examples: pre-operative fasting and careful airway management for anesthesia. Supervision and rapid help for people intoxicated, seizing, or with impaired consciousness. Positioning: side lying, if vomiting or very drowsy.